Good afternoon. My name is Menashe Miller, Deputy Mayor of Lakewood Township, and I'll be the moderator of today's session. Today's session is called Vaccines Discussions, bridging halacha, expertise, and policy for public health. With vaccines once again in the forefront of the media and the Senate confirmation of RFK, this is likely to be one of the hottest topics at this year's conference. Chemin organization has gone far and wide to put together a group of panelists who will be discussing this topic. First and foremost, we have Rabbi Weiss Shlita, who's among the most renowned and respected international halachic authorities in both medical science and Torah halacha. Rabbi Weiss has written numerous books and svarim under the name of Minchas Asher. He is also the Rosh Kollel of a prestigious kollel in Yerushalayim, as well as the chief rabbi of the Shaare Tzedek Hospital in Jerusalem, Israel. Next up, we have Dr. Paul Offit, MD. Dr. Offit is Director of Vaccine Education Center and Professor of Pediatrics in Division of Infectious Disease at Children's Hospital of Philadelphia, otherwise known as CHOP. Dr. Offit has written numerous medical papers, a lot of them discussing the rotavirus, and has actually co-invented the vaccine for the rotavirus, which is recommended for infants by the CDC. And for that, Dr. Offit has received numerous awards. Next up, we have Rabbi Fried. Rabbi Fried is the Executive Director of High Lifeline, New Jersey and Pennsylvania, as well as a national and international speaker on families with terminal illness, crisis, and cancer. He's also known in the hallways of CHOP and is a sought-after speaker on those topics. Last but not least, we have Jeff Adest, who's an attorney in the medical field, and he will be discussing also questions that come up with regard to vaccination. We had initially advertised that Assemblyman Avi Schnall, the 30th Legislative District Assembly, will be here as well. He's running late, and if he comes here, he'll be joining the committee. Without further ado, I'd like to introduce the panelists. Each panelist will be given 5 to 7 minutes of opening remarks, and from there, we will be opening it up to the public for questions and comments. Without further ado, I'd like to ask Rabbi Weiss to give us our opening remarks.
So before saying anything else, I want to thank Dr. Friedman and his entire staff. I've been coming every year since this conference was born and conceived, I think. And even though it's a major effort, but I see it as a privilege and a schus. And one cannot underestimate or overestimate the importance of rabbonim and doctors and medical professionals coming together to share challenges and to deal with medical issues. And it is of extreme importance to rabbonim to have the input of the medical professionals, as it is for the medical professionals to have the input of poiskei halacha and rabbonim. So dealing fundamentally with vaccinations, I think it was 1795 when a British doctor, researcher, Edward Jenner, discovered or developed, one could use different terminology, the vaccine to eradicate smallpox, and he saved the world. Smallpox ravaged continents, peoples, nations, as we know not only from medical history, but from our sources as well. The Magen Avraham in Siman Tov Kuf Ayin Vav quotes the Shlo, and the Shlo says, all those families and parents that do not move out to the countryside with their kids to salvage and save their kids, atidim latet et adin. So hundreds of thousands perished, and Edward Jenner came up with the first vaccine. The Teferes Yisrael Perek Gimel Masechet Avos, when the Mishnah says, Chavav Adam Shenivru B'Tzelem, and the commentators deal with the question, does that refer only to Jewish people or to humankind as a whole? And the Teferes Yisrael quotes, Aroifa Jenner, Vadai, he's going to have Gan Eden because he saved hundreds of thousands of people. So the Teferes Yisrael exalts Edward Jenner for saving hundreds of thousands of people. And 5 gedolim deal with the question, is taking that vaccine legitimate in accordance to halacha? The Tefillah Soul in a different source, Perikes Masechet Yoma, writes, but we do know of cases that people died right after taking the vaccine. And some argue that this vaccine might be detrimental to human life, and sometimes it might cause death. Nevertheless, writes the Tefillah Soul, even if that would be true, and we do not know whether it's true, still we should vaccinate, because the benefit and the number of lives that would be saved is far, far outnumbers those that might be jeopardized. And we find the same dilemma and the same ruling in 5 sources of our giants in halacha. I quoted the Tefillah Soul Perek Ches Masechet Yoma. Shuvema Ahava was the greatest disciple of the Noda B'Yehuda, and his Sefer Chelek Aleph Siman Kuf Lamed Hey, he writes, it is legitimate to vaccinate even on Shabbos. It would permit Chilul Shabbos to take the vaccine. Number 2. Number 3, Rabbi Shmuel Kohen Gadol. Anybody knows that name knows Rabbi Shmuel Kohen Gadol was in the days of the Tanaim, but one of the great Gedolim in the Sephardi world 200 years ago was Rabbi Shmuel Kohen, Shelot V'Tshuvot Zera Emes, Chelek Beis Siman Lamed Beis. He was known in the halachic world as Rabbi Shmuel Kohen Gadol, even though he is somewhat doubtful, because maybe this vaccine is killing people. His conclusion is, nevertheless, we would recommend vaccinating. Yad David Zintzayim, and we're moving from Spain to Germany, Yeridei Chov Gimel. This sefer was printed the first time, Tofshin Ayin Dala, just 11 years ago. But the author lived 200 years ago, and he says the same. Sefer Bris is not really a halachic sefer, an interesting sefer that was composed almost 200 years ago. And he writes, 30 years ago, this vaccine first came out, it first became available, and we trust Reb Shimon Doctor. Nobody knows who was that Reb Shimon Doctor. Probably a doctor who was known in his community as Reb Shimon. And we trust him, and everybody takes this vaccine, and people are well. Ziv Chei Tzedek, one of the Sephardi Gedolim, quoting Zera Emes, and he says, even though the Zera Emes was somewhat skeptical, but we lived 70, 80 years later, and the vaccine was improved, and everyone should vaccinate. So these sources in halacha deal with a dilemma. Some people might be dying. Nevertheless, all these 5 Gedolim agree we should vaccinate, because the benefit and saving lives far outweighs and outnumbers the possible risk. 100 or 200 years have transpired. Our vaccines are far more viable than those in the past. We have no real medical, documented, verified information that vaccines are detrimental to our health, and therefore, in my opinion, as I said, many opportunities, and I wrote this in Minchas Osha on the COVID pandemic. 4 years ago, after a year of COVID, I published one of my many sforim, Minchas Osha, on COVID. When the sefer came out, a person approached me and said, Rav, I always admired you greatly, but I didn't know you're a prophet. And I said, neither did I. Will you please share with me how you reached that conclusion? Maybe I am a prophet. Maybe you'll convince me. So he said, I'm holding in my hand a 650-page volume. You started writing this book 4 years ago. How did you know COVID is coming if you're not a Navi? And I said, you disappoint me. I thought you may have some more convincing argument. I did not start writing this book 4 years ago. But when questions pile up on your desk and you are required to answer, you have siyata d'shmaya. So I made it very clear in that book, not only regarding the COVID vaccine, but all the vaccines, especially those that are given to infants, should be taken. Yerushalayim, a few years ago, people stopped vaccinating for measles, and there was an outbreak of measles. A few children died, actually, in Eretz Yisrael. So this is a very bad idea. If it is true that vaccines might be detrimental to your health, and I once again said, I am not aware of any serious scientific medical information. Still, as all the Gedolim I quoted, and they did assume that some people are dying from vaccinations, which is not true today. Nevertheless, their psak was, we still should vaccinate. Because when we're dealing with danger to an entire community, to an entire people, to society, that concern clearly outweighs any potential risk to the individual. So we will hear some different discussions this morning. I just wanted to give a general halachic overview about this most important topic we are dealing with. Thank you, and my Choshele colleagues.
We're going to be here next from Dr. Paul Offit. He's not here in person, but he's here on Zoom.
Can you hear me okay?
Yes.
Yes, okay, good. Let me tell you what scares me. What scares me is measles. Two reasons. One is that it's clear that there is now an erosion in vaccine rates. More parents are choosing not to vaccinate their children for non-medical reasons. Two is that measles is the most contagious vaccine preventable disease. In fact, it's the most contagious disease, infectious disease. I'll put this in perspective. There's something that epidemiologists have called the contagiousness index, meaning how many people will you infect during a day, assuming you live, you're contagious, and assuming everybody you come in contact with is susceptible. For diseases like COVID or influenza or respiratory syncytial virus, the contagiousness index is between 2 to 4. For measles, it's 18. And the reason is you don't have to have direct face-to-face contact with someone who has measles. You just have to be in their airspace within 2 hours of them being there. When someone comes into our hospital with measles and is in the treatment room and then leaves that room, no one can go in that room for the next 2 hours until these tiny droplets that sort of hang in the air like a ghost settle. And you're starting to see measles outbreaks. There are now 48 cases in West Texas associated with 14 hospitalizations. There's now a recent outbreak in Norfolk, Virginia, and there are at least 6 states now that are suffering outbreaks. Also, the CDC, under the current administration, has been to some extent disabled. So whereas normally you would get reports on those outbreaks from the CDC every week, now they're restricted to reporting them every month. So it's hard to know what's going on. And people may not remember measles, and that's the problem. I think it's not only that we largely eliminated measles, we've eliminated the memory of measles. Measles can make you sick. And when measles was alive and well in this country before there was a measles vaccine. So there was a measles vaccine introduced in 1963. The last best measles vaccine, the one we use today, was introduced in 1968. But if you were a child of the 50s, like I was, you had measles, you had mumps, you had German measles, you had all these infections. And at that time, before there was a measles vaccine, every year there would be 50,000 children hospitalized with measles because of severe pneumonia, measles pneumonia, and severe dehydration. There would be 500 who would die every year of pneumonia or again, severe dehydration. And what people may not remember is every year, 1,000 children would get something called measles encephalitis, which is inflammation of the brain, which would leave 1/4 of those children blind or deaf. There's another complication of measles, which most people haven't seen because it's rare, which has the acronym SSPE, which just stands for subacute sclerosing panencephalitis. And here's what that is, and I've seen 5 cases now. Children get measles, they recover, they're fine. Then 5 years later, 7 years later, they come back with a deterioration in their personality, a deterioration in their handwriting skills. And then slowly they have decrease generally in motor skills and sensory skills. And ultimately they die. invariably. There's nothing you can do about it. You just stand back and watch this child fall off a cliff in slow motion. And I just feel like with Robert F. Kennedy Jr. now as head of Health and Human Services, I fear that what he did, for example, in Samoa years ago, around 2018, 2019, was he went there to watch a measles epidemic that ultimately in this island nation of 200,000 people caused 5,600 cases and 83 deaths. And he stood back and watched that happen. He didn't encourage vaccination. He didn't want children to be vaccinated. He basically made that clear. And then when the outbreak occurred, he denied that it was actually measles virus that was causing it. He said it was just a defective vaccine virus that was causing it, which was not true. So I don't trust him. I'm very, very disappointed that he is now Secretary of Health and Human Services. And if you really want to scare yourself, read 3 pages in his book this book is The Real Anthony Fauci. And you will find out that Robert F. Kennedy Jr. does not believe in the germ theory. Right. That specific viruses or bacteria cause specific diseases and that the treatment or prevention of those viruses or bacteria can be life-saving. He just thinks keep a healthy immune system and you're good. As he said, when he sees a child being held by a parent as he's on a white hiking path or running path, he goes up to those parents and says, don't vaccinate your child. And he says, according to him, he believes he saved that child. This is a man who believes vaccines cause autism, which is wrong. And he is going to do everything he can, I think, to make vaccines less available and less affordable. So that's my grim 5 minutes. And I turn it over to the next speaker.
Thank you. Our next panelist we're going to be hearing from is Rabbi Fried of Chai Lifeline.
Thank you so much. First of all, Yasher Koach to the Rav. Jeff, filling in last minute, thank you. Thank you, Dr. Offit. First of all, did not realize you were born in the 50s. You look a lot younger from Florida. I don't know how you got away with it. You're the first presenter at the Chemet conference to do it on Zoom. It's an absolute no-no. But when I told Dr. Friedman, I explained that Dr. Offit is going from speaking to one senator to another to giving one interview on CNN. I don't know if you were on Fox, if Fox ended up calling you, but literally nonstop interviews. We made that exception, and we're glad we made that exception. Thank you, Dr. Offit. Who am I to speak on this topic when we have the Rav here that's one of the greatest experts in the world on it, and Dr. Offit on the scientific end? There's not much I can add. What I will try to add just in a few minutes is the social perspective of it. As someone that has been involved as a case manager, social worker, and director of the New Jersey region of Chai Lifeline now for close to 25 years, and going to Children's Hospital of Philadelphia for close to 25 years, I've seen firsthand the effects of what the anti-vaxxers have on the community. I've been in the room where 2 babies have taken their last breaths due to whooping cough, otherwise known as pertussis. So I've seen that impact that it has by the lack of the herd immunity when it comes to whooping cough. I deal with a population of immunosuppressed children, children with cancer, other illnesses, children that have been in the hospital for weeks and months on end, finally come home, want to be able to go out to play, want to be able to go out and go to school, and simply can't because of the anti-vaxxer movement that's out there. But I think that there is a component here that I think we can do a little differently, and I would ask others, I would ask the Rav and both Dr. Offit to chime in on it as well. And that is the concept of when we speak about vaccine education. I think it comes across, and I'm out in the field every day, and I speak to people about vaccines every day, and I speak to schools, to communities, to families, individuals, and I plead with them to vaccinate their children. Because I'm an advocate for the children that I served, which is, the most vulnerable children in our community, children with cancer and other illnesses. And I plead with them. And what I find is that we as a scientific community, even a halachic community, come across as lecturing to them, come across that they simply don't get it. They simply don't understand both the halachic perspective, the legal perspective, the medical perspective. And we're not coming across that we're aligning with them. Dr. Lebowitz spoke this morning about the number one thing is just to show them that we're on the same side. We're not on two different sides of the issue, but we're constantly coming across as confrontational and there's two sides to this issue. We have to be able to align ourselves with them and say, we have the same interest for your children as you as parents have, but allow us to educate you what the best interest for your children is. And I think there's another concept here that is important discussing. We have to be able to bring out the human toll of it, talk about vaccines from a human interest story. I know I was speaking, what's the Rav's, who the Rav was with, always introduces the Rav from Yerushalayim, told me there's a 17-year-old boy engaged in a Jerusalem hospital now with polio vaccine, with polio, because he wasn't vaccinated. We have to be able to share human interest stories. Human interest stories is what connects to people, and we have the ability to persuade people through a human interest story. There is another component to it. We are the greatest and kindest community out there. We do the greatest amount of chesed. When our next door neighbor has a child that's born, there is the amount of food that we send, the amount of organizations that are there to help, the amount of respite that we provide for families, large families. There's nothing like it out there as the Jewish community in terms of how we support each other. I tell families that don't want to vaccinate, and specifically again for pertussis, I say, do you realize that by creating a herd community, by creating that community, we are able to provide the greatest chesed possible? Do you realize that infants cannot be vaccinated for pertussis? And if we create this protection for them, that's the greatest chesed you can do. That's the greatest act of kindness you can do. Listen, the militant anti-vaccine community, we're not going to influence. There's nothing we as a group here can do anything about it. They will figure out their ways against school mandates. There is nothing scientific, halachic, emotional that you can do to change their mind. But the reality is that especially since COVID, the peripheral around that has grown tremendously. I can't tell you how many families I speak to that always vaccinated that now start questioning it. And that's the community we need to focus on. And we need to focus on them by making sure we align with them, making sure that we're not lecturing them, making sure that we highlight the human toll of what the anti-vaxxer movement has done, and to tell them and explain to them that the greatest chesed you can do is by creating herd immunity. If you vaccinate, we can assure that that defenseless newborn child will not end up in CHOP fighting for their last breath. Thank you.
Thank you. Our last panelist for today is going to be Mr. Jeff Adest, Esquire, who will be speaking on the legal aspect of vaccinations.
Good morning. So, B'kavod HaRav, I first want to thank my family for making sure that I came on time so I could get jumped as I walked in and asked to be able to speak. So I will not have 5 to 7 minutes. I'm just going to give my quick thoughts. I will also say that generally when I speak about topics that apply to medical professionals, and almost none of the medical professionals come. So I guess today you're stuck because you came for Rabbi Weiss, so you're stuck with me. I want to talk about a different aspect, which is the aspect that comes to me. Whether or not there should be mandates, whether or not people should be vaccinated is not for me to decide. What comes to me is when there are mandates and people go around and commit fraud to pretend that they got the vaccines, or to otherwise be able to get into schools, get onto airplanes, get into work, anything that needs to be done where you have a mandate to get vaccinated. I will say as providers, on the providers in the room, statistically, there's probably somebody in this room who's an anti-vaxxer. I'm not saying there is specifically, but statistically there is. If that's your position, then go ahead and let that be your position. But don't go ahead and be signing papers for people saying that they're vaccinated when they're not. If you're an individual person who doesn't believe in it, then stand up and don't believe in it. But don't go and get fake papers to do it. We've had many cases across many of my clients where we find a nurse, a doctor, somebody who's giving out, right, during COVID, there was a lot of this, people saying they're giving vaccines, they really weren't giving it. What ends up happening, putting aside the harm to the community everyone else has talked about, is it becomes a legal problem. It's a tremendous chil Hashem because people find out about it. There's no place that someone is working where there aren't people there who are going to feel differently about it, who are going to come complain about it and come see about it. So I really strongly encourage you, if you want to believe that way, go ahead and believe it, but don't spread it to other people. Don't help other people commit fraud.
Thank you. It's at this point we're going to open it up to the public for questions. This is not the opportunity for you to share your political views. That could be done over lunch. This is an opportunity for you to ask a question to one of the esteemed panelists. So I raise a hand, I'll make my way over to you with the mic, and again, it's for questions.
For Rav Weiss. Two questions, Rav. One is you can comment on, do you feel that chisunim, immunizations are a chova or a hamlatza from a halachic point of view? And the second question is what's the perspective on Gadol Yisrael, specifically two in America and probably one in Eretz Israel, who are anti-vaxxers?
It is not only a recommendation, it is a clear halachic chiyuv. It is mandatory, it is obligatory, and not only a recommendation. I think it's a sin not to vaccinate. So I once again say, as I mentioned before, is there any danger to vaccination? We are not aware. I'm not a doctor, I'm not a researcher, I'm not a scientist, but to the best of my knowledge, there is no scientific proof of any danger coming out of vaccination. As mentioned before, I have realized there is no chance in the world to have a sensible dialogue with anti-vaxxers. I have been attacked on the street by anti-vaxxers. I've been shouted out in public, and I don't think we can have any dialogue with anti-vaxxers. But we do need to educate people, first of all, from the halachic standpoint. It is a chiyuv gomer. What is this chiyuv based on? Fascinating tshuva that I disagree with, that we find in Mincha Shleima, Reb Shemesh Zalman Auerbach, in the second chelik in Mincha Shleima Siman Pei Beis. And Reb Shemesh Zalman says, just like in war, and we are in war. For the last 15 months, we have been engaged in a painful, profoundly sad period of war. So when waging war overrides pikuach nefesh. And even though Rabbi Kiva teaches us, chayecho kodmim lachayecha vecha, that rule does not pertain to war. An army whose ethos will be, put your life before the life of others, will always lose wars. In war, soldiers are required to put the life of their brethren, of their comrades, of their friends, of the citizens they protect before their own life. So Rabbi Shemesh Zalman argues, when we're dealing with medicine and fighting an epidemic or a pandemic, even if people might die, it still is a chiyuv. No, I don't think this could be compared in any way to war. And we should clearly say people aren't dying from vaccines. People are dying from the sicknesses that the vaccines are here to eradicate, to protect us from. And I think dealing and speaking to the general public, as my dear friend Rabbi Fried said, don't lecture. Try to be on the same side. And I say, yes, I agree, but we should lecture as well. And we should tell the people that anti-vaxxers are ignorance. They're ignorance, and they do not know what they're talking about, and they are against halacha. It is a halachic obligation to vaccinate your children. If you don't vaccinate your children, your neighbor might not, and your children might not vaccinate their children, and this has a ripple effect and sooner or later, epidemic will break out. Dr. Offit, I don't know whether he's still with us. He's not on the screen. But as he pointed out...
He's here.
I'm the only one in this crowd that got no applause. Did you realize that? Okay, I feel better now. As Dr. Offit spoke about the measles vaccine, and I also mentioned, because a few years ago we had an outbreak in Eretz Yisrael of measles, and I don't need to confirm what he says. I'm not a doctor, I have very little medical knowledge, but I do know that measles is the most contagious illness that we know about, but the same goes to other vaccines. We clearly need to say this is a halachic obligation, and there is no basis to the argument of anti-vaxxers. How do we relate to Gedolim that are against vaccines? Let me say this very simply. Great people sometimes have big mistakes. And in Judaism, we know this. No one is perfect. Great people could have great mistakes. Big people could have big mistakes. And we need to remain respectful. We need to remain respectful. But truth is truth, and facts are facts. So even great people could have mistakes, and sometimes great people have great mistakes. So our challenge is to remain respectful and to learn Torah from those very same people. They are great, they are holy, but if they are against vaccines, they are making a tragic and huge mistake. And we should not be, forgiving and compromising. We need to say loud and clear. My opinion is it is a total halachic obligation to vaccinate your kids. I hope that was a sufficient answer.
Thank you. We have one addition here from Rabbi Fried.
Okay, I already had enough applause. Thank you.
Question is...
One second, just one moment. If I may add to this, although I'm not a Rav, and I'm not going to lecture, but I remember going in with Rabbi Scholar, the CEO of Chai Lifeline, to Reb David Feinstein Zatzal, and having a conversation specifically about this, about what do we do with Gedolim, great leaders that are anti-vaccine, and we had asked him to sign on to, put out a proclamation how important vaccines are. And all he kept saying was, it's not the place for Gedolim. They are experts in Torah, and they are not experts in medicine. He says, the mere fact for me even saying that you have to vaccinate validates this concept that there's a place for me to be involved in this. There is none place for me to be involved, and he wouldn't even sign to say that you have to do it. He says, the only thing I can sign is just go to your doctor for it, like everything else. That was Reb David, that's all.
Rabbi Fried, I totally disagree with what you just said. This is a very friendly and frank conversation. But if Gedolim won't make their voice clear, people will doubt. Some doctors say this, some doctors say that. Let me say something. You have good doctors and you have bad doctors. You have smart doctors, you have stupid doctors. As we have in any other field of human endeavor. The fact that he has a degree doesn't mean he's always right. You follow the opinions of the medical establishment, and that is halacha. There are so many sources in halacha. We follow doctors. But if Gedolim won't say their opinion, many more people will not vaccinate. Because if it is only doctors saying what they say, people will always find other doctors. I don't even know whether RFK is a doctor. Maybe he is. I don't know. He's not. Okay. But you could find some doctors that will be anti-vaxxers. They're not common. And of course they're not common, but I think Gedolim need to voice their opinion. So Reb David was one of the greatest Gedolim of our time, but he was the most humble person. He was such a great onev, and he didn't think that he is fitting to speak about this. And I so much loved and respect Rav David Feinstein, Zechat Tzaddik Levracha, but I think if that is what he said, that's wrong. And I think Gedolim must voice their opinion in the most vocal and not being offensive, but being totally clear in their opinion that you must vaccinate.
Question here. Considering that preventive medicine in general and vaccination specifically don't really treat a person right now who's sick, they treat they are to prevent somebody in the future who may get sick. If it's Bari Shema, it's a Shema. And considering also the basis that we will hear of medical practice being based on Vashevosolo, you should restore to him, or Lo Samo Adam Reyecho, or etc., etc. Just technically, how does preventive medicine, which is to prevent something that may or may not happen in the future, or perhaps you can consider that you're treating an entire population, how does it fit halachically on those bases? You're not restoring something. There's nobody before you who's dying that you're standing by his blood. How does it just technically come from these bases for halachic bases for the obligation to heal?
So let me give a short introduction to explain the question. I don't know what the name of the person is that posed this question, but let me explain the question. In Halacha, we have a concept which in Hebrew is chole befonecha, which means the ill person is present, he is here. But that concept only pertains when we need to violate Shabbos or Yom Kippur to save a person. In that case, there might be a difference between saving people in the future or saving a patient who is right here and now. That is irrelevant when we're not dealing with Chilul Shabbos or eating on Yom Kippur, but just preventing illness, preventing death, preventing tragedy. Of course, it is a halachic obligation to do everything in our power to prevent pandemics or epidemics from occurring, and not only treating patients when they are ill. Common sense would dictate, and that is also halacha, that it is far more reasonable and more imperative to prevent illness and the outbreak of illness than treating patients when they are ill. If we will wait till they become sick, many of them will perish. So it is our obligation to do whatever we can to prevent illness. And in my sefer, in my book on Corona, I quoted many sources of Chazal. I'm trying to translate words because I don't know whether Dr. Offit learned in yeshiva, and I want him to understand what I'm saying. So the Talmud clearly give instructions how a society should conduct its affairs when an epidemic strikes. And the sages teach us, what was known then, what was considered medical knowledge then. You need to leave the city, you need to go out to the countryside, lock yourself in your home, don't come between people. And that is what we've been doing during the COVID pandemic. So there are many sources in the Talmud which teach us that to prevent illness and prevent the outbreak of epidemics is far more imperative, and that is our obligation, and not only after tragedy strikes to try to minimize the toll. So you were referring to chole befanenu, when the sick is here. That is a concept which is relevant only in Shabbos and Yom Kippur, and even then, in a very limited way. So it is clear as daylight that in accordance to Halacha, we need to do everything to prevent illness, to prevent tragedy, and to be proactive and do whatever we can to save lives in the future or to save people from endangering their lives and not only saving people when they are ill.
Our next question will be for Dr. Offit from Dr. Daniel Roth.
Thank you to the panel for a wonderful discussion. I have actually a question for Dr. Offit, a question for the Rav, and a question for the panel. The question for Dr. Offit is, given that we are fortunate now to have such an extensive number of vaccines for so many different illnesses, is there a basis or concern that by giving too many vaccines or so many vaccines all at once to young children all at the same time or close proximity can overwhelm the immune system and potentially increase certain side effects? And is there any scientific or validity to the idea of possibly spacing them out? My question to the Rav is fine. I'll say them all. The question to the Rav is there a basis for a frum family to not have their child vaccinated against HPV because it's only an issue for children if they become sexually active and if they're confident that they're going to raise their children in a frum environment, they shouldn't have to worry. And the question to the panel is, in general, I think many of us who have full confidence in vaccine and their benefits have to be cognizant to the fact that even an antibiotic has a side effect, and that there are rare side effects, whether it's Guillain-Barré or whatever it might be, in rare circumstances that can occur. And even though the autism, voice has been disproven, I think it would be a little bit pretentious to say there's never ever been a side effect or reaction, and vaccines are completely safe with nothing to ever worry about. Clearly, the benefits far outweigh the risks of any sort. Should we be modifying and be a little bit less dogmatic so that people can understand the reality that we're not claiming that it never can happen, but that it's so remote that we don't worry about, just like we don't worry about getting in the car, which also carries risk? Should that maybe dialogue be modified a little bit in our community? Thank you.
Dr. Offit?
Sure. So to answer the first question, I think we ask a lot of parents in the United States. We ask them to, in the first few years of life, prevent 14 different diseases, which can mean as many as 25 inoculations during that time. It can mean as many as 5 shots at one time, to prevent diseases that most people don't see, using biological fluids that most people don't understand. I think it would be surprising if people didn't push back at some level or were somewhat concerned about all of that. So the question is it more than they can handle? So it's really not the number of shots that matters. It's the number of immunological components in a shot. So in other words, take the COVID vaccine, for example. That was one protein from the virus. Same thing for the hepatitis B vaccine or the HPV vaccine. Those were sort of one protein from the virus. So it's one protein that is the challenge. If you add up all of the immunological challenges in vaccines today, it adds, I'm talking about viral proteins, bacterial polysaccharides, which is the complex sugar coating of bacteria. It adds up to about 170 total. Now, 100 years ago, we gave one vaccine, which was the smallpox vaccine. The smallpox is actually the largest of the mammalian viruses. It's the only virus you can see by light microscopy. That virus had, with structural and non-structural proteins, had about 200 immunological challenges. So really, we gave a greater immunological challenge 100 years ago, in a sense, than we do today. In terms of safety, just in general, because it's a good point, anything in medicine that has a positive effect will have a negative effect. The only question is how rare and how serious. If something never has a negative effect, it probably never had a positive effect. So I think that we need to consider that. So for example, the oral polio vaccine, which we gave in the United States from the early 1960s up till the year 2000, could itself cause polio. It was rare, but it was real. Those live attenuated strains could revert back to paralytic type and cause polio. In fact, that case in Rockland County of that 27-year-old man who had polio, that was actually caused by a vaccine-derived strain. Same thing with the outbreak in Gaza. That's a vaccine-derived strain. The influenza vaccine can be a rare cause of Guillain-Barré syndrome, which is an ascending paralysis. So sure, I mean, but do the benefits of vaccine clearly and definitively outweigh the risks? Yes, because a choice not to get a vaccine is not a risk-free choice. It's a choice to take a different and more serious risk. But so you're right. I think we need to couch that in the right way, which is that safety isn't absolute. It's relative here.
Could I just Could I just add on to what Dr. Offit just said? Once again, I know very little about medicine, but I think that the measles vaccine was developed in 1960, and it was starting to be used broadly. And in England and other European countries stopped the vaccine in about 1961, 1962, because they realized that it is causing measles in some children. So every vaccine is derived from the virus or the bacteria it is meant to prevent. And then it was bettered, and towards the end of the 60s, it was considered totally safe, and then it was used broadly in most of the developed countries. So that was a very wise line I never heard before. A medicine that would have no negative effect probably won't have positive effect. This is something I never heard before. So I think every medicine might, in extremely remote circumstances, have some negative effect. And I actually want to share with you a psak that I gave. A person asked me, I am known to be pro-vaccine. And a person called and asked me, I am vaccinating 2 children, and very close to being vaccinated, they developed serious eye problems, both of them, one after the other. The doctor said, we do not see correlation. We do not see cause and effect. But this person was afraid. I vaccinated 2 children, and immediately after the vaccination, they developed serious eye problems. Do I need to vaccinate number 3? And I said, no, do not. If I were you, I would not vaccinate number 3. So let us make something clear. Rabbi Fried spoke about herd immunity. This is a concept which I don't think we have time to discuss, but it is all about herd immunity. The more people that are vaccinated in a society give protection to the entire society. So if everyone else is vaccinated and one person is not vaccinated, he will not be in real risk. The problem is, who's going to be that individual that will not vaccinate? If you won't, your neighbor won't, your son won't, your father won't, and many others won't, and then you're putting the entire community at risk. So when this person told me, I vaccinated 2 children and both developed serious problems right after vaccination, I don't know. But if I would be you, I would not vaccinate number 3. I don't want to go into the argument between Rebbe and Reb Shimon ben Gamliel. Don't wait for number 3. If you're vaccinating 2 kids and develop problems, don't vaccinate number 3, even though the doctors do not see correlation. But it's troubling if both children developed a similar ailment. I don't know. There might be something else in your home or what these kids are doing or what they're getting that might be causing these problems. I just bring this as an example. So one could never say with 100% certainty that vaccines cannot do any harm, as Dr. Offit said. And that is why I quoted the many sources. Today, more than ever before, with all the scientific knowledge that we have accumulated, the benefit outweighs the risk 1,000 times over. And that is why I once again say we should clearly say that it is a chiyuv to vaccinate.
Our last and final question will be Dr. Hilton Leighton, pediatrician.
Hi, this is for the panel and Dr. Offit. Even though one's not confrontation with the patient, and you explain that you've seen all these diseases, especially since I was born in the 50s, how do you overcome the mother networks and these social groups and these people that call themselves crunchies, that they refuse to allow the vaccines because of the adjuvants like aluminium, etc.? How do you overcome them when they listen to their social groups and there's a whole group that follows a certain physician who delays the vaccines and says certain ones are definitely not necessary, there's no rotavirus, you only give 1 IPV, and you shouldn't start giving vaccinations after a year. Even if you educate them, I just kick them out of the practice, but how does one overcome the argument of adjuvants, etc., etc.?
Thank you.
Okay, so aluminum salts have been used as an adjuvant in vaccines really since the 1940s. So if someone comes in and they say, I'm worried that this aluminum adjuvant in vaccines is somehow could cause autoimmune diseases or rheumatologic diseases, there is abundant evidence looking at aluminum in vaccines. I mean, we've had that in vaccines for about 80 years. I think what I try and do, first of all, I try and figure out what it is that's upsetting them. If we use this as an example, aluminum, then there are data. So aluminum is the most abundant light metal on the Earth. I mean, assuming you live on the Earth's crust, which pretty much we all do, then you're going to be exposed to aluminum. Aluminum is in the water you drink. Aluminum is in breast milk. Aluminum is in infant formula. And aluminum then is absorbed from the intestine into the bloodstream. So the question is, are you exposed to more aluminum if you get an aluminum-containing vaccine as compared to just living on the surface of the Earth? And the answer is no. If you look at children who get aluminum-containing vaccines, for example, and then look in their bloodstream or look in their other biological places like hair, for example, where aluminum can be stored, you can't tell that this person has been exposed to aluminum because they live on the surface of the Earth where there's aluminum. So that's what I try. I try to do that. But you're right. I mean, you're going up against this sort of misinformation and disinformation on social media, and you're up against the distrust, that somehow we're all covering something up, and you just do the best you can. And if you can't win, then you didn't win. My wife's in private practice pediatrics, and I've watched her dealing with this now for 30 years, and she tries the best she can, but she sort of had it a few years ago, and she's just said, look, let me love your child. Don't put me in a position where you're asking me to send this child out of the office, knowing that there's diseases out there like pneumococcus, like human papillomavirus, like measles, et cetera. Please don't put me in that position. I can't do it. I can't conscience it. It hurts me. So by putting herself on the line emotionally, she became far more able to convince people than before. But that's just one suggestion.
This concludes the panel. We thank everyone for coming. There'll be further question and answer panel set Motzei Shabbos. Feel free over the weekend to submit your questions that can be asked on Motzei Shabbos. Thank you all.
Thank you, Dr. Offit. Thank you.
Thank you, guys.
Thank you.
Take care. Nice meeting you.